Thank you, Madam President, or Madam Chair. Sorry. Well, this has been a long hearing today, but I think a very needed and thorough vetting of the bill before us today. And I will say that I'm very sympathetic to the advocates of this bill. I am no stranger to long and hard goodbyes. We are facing that right now. I understand that concern. But there are a number of moving pieces here that are a little bit, I think, disjointed. On the one hand, it seems to be that the impetus for this bill is because of the results of failure by the medical community or the hospice community to be able to alleviate all pain. That was one of the comments that we heard from Mr. Diaz, that in fact the pain could not be relieved. And that was one impetus for this bill. But it is the American College of Physicians Ethics Manual specifically states that the physician may appropriately increase medication to relieve pain even if this action inadvertently shortens life. So that is that principle of dual effect, so that the ability to relieve that pain may have that secondary effect of hastening death. That is already current law. And in fact, the courts have upheld that consistently. And so I am left wondering why we have the need for this legislation, which is why I asked Mr. Diaz about the liability question. And I would say that I am fearful that there is now an implicit, unspoken request to doctors that by someone seeking this lethal prescription, that in effect this life is no longer worth living. And I am concerned about this duty to die and this burden upon families, the supposed burden upon families. And many of us here, we know our parents. We know exactly about they're always thinking about others first. And so I'm concerned about that duty to die. And I'm also wondering about the fact of this cause of death, that the cause of death, according to this bill, is not the lethal dose or the fatal drugs or whatever the procedure is, but the requirement is that the cause of death be listed as the underlying illness. And I'm left wondering, why is that so important? And you might be familiar with the term moral hazard in insurance. And I have to wonder, moral hazard is when there is an incentive for inappropriate action to have financial gain in the insurance industry. That's one of the terms that we are always cognizant about, is moral hazard. And so I worry about moral hazard when we can't even identify properly the cause of death. And then I'm also concerned about the fact, in fact, I think it's important to know that physician-assisted suicide is fundamentally incompatible with the physician's role as a healer. And of course, it was articulated first in the Hippocratic Oath. The opposition to assisted suicide continues. It's affirmed today by our leading professional organizations, including, but not limited to, the World Health Organization, the American Medical Association, the American College of Physicians, American Society of Internal Medicine, American Academy of Medical Ethics, American Nursing Association, and American Psychiatric Association. This aid in dying is just contrary to the physician's oath to aid in living. So I think it's our highest priority to alleviate pain and other symptoms. And of course, patients have the right to refuse treatment In fact, we know patients have the right to refuse life-sustaining treatment. I'm very well aware of that. But I think it is a very different thing to administer the life-taking treatment. That is a very different thing. And so, and I'm concerned about elder abuse with this. We can see that happening, and I can see also the concern with the disability community as well. So, members, I will be calling for a roll call on this. I think it's a very dangerous precedent for us to undertake.
A roll call has been requested, and when we get to that, we'll talk about that. There were a series of questions in that, Senator Eaton, related